Welcome to Knees and Balance, a holistic approach to managing knee pain. My name is Dr. Tina Schaffner, and I'm a licensed physical therapist at Neil King Physical Therapy. Today, I'll be guiding you through some simple stretches and exercises to help alleviate your knee pain. Before we begin, let's talk about knee pain. Understanding knee pain is crucial for managing and alleviating discomfort effectively. It's important to recognize that knee pain can stem from a variety of causes, including injury, overuse, or underlying conditions such as arthritis. The knee joint is complex. Structure comprises of bones, ligaments, tendons, and muscles that all must work harmoniously for optimal function. When any part of this intricate system is out of balance, pain can result. Factors such as muscle imbalances, poor posture, lack of support, or improper movement patterns can also result in knee pain. By identifying the root cause of pain, we as physical therapists can tailor a treatment program that's specific to you. That program includes manual therapy, stretches, strengthening, and movement reinstruction to promote healing and prevent future injuries. Education on proper body mechanics and lifestyle adjustments are also a key factor in recovery and managing your overall long-term knee health. It's important to listen to your body and seek medical advice if your pain persists or worsens. Today, we're going to go through some more advanced exercises that advances some of the stuff that we did in the basic exercises. This is not designed for the beginner. These are for those of you who have already been part of a strengthening program, and maybe you're out of rehab and you're now trying to progress back into some more high-level activities, including running, jumping, boxing, or whatever your method of choice is. Once again, I've got my team member, Becky Pace, Doctor of Physical Therapy at our Macomb location, who's gonna help show us some of these exercises. We're gonna start first with some of the exercises that are on the bed. Few of these are advanced, so if you'll notice in the first video, we did a bridge with both legs down. Now we're gonna make it a little bit harder. We're gonna lift one leg up, and she's gonna do a single leg bridge. So from here, you can keep the leg straight. You could make the knee bent. We'll have her do the harder one today. So belly muscles staying engaged, and she's gonna lift up from the bridge and come back down. What we're looking for is to make sure that her hips stay level as she's lifting and as she's lowering. She's keeping this thigh muscle nice and tight. You might notice this is more challenging than it looks. So you may need to bend this knee in and maybe do every other repetition with the leg straight or bent. Next one we're gonna do on the table is what's called a side leg lift. We did the clamshell in the first video. This goes after a few different muscles. Belly muscles engaged. She's just gonna lift this leg up and lower it back down. Now, oftentimes we see this one done inappropriately, or people lift way too high and they're changing the spine. That's not what we're looking for. We're looking to keep the motion just in the hip, because the hip and the thigh muscles really are what support the knee. Belly muscles stay nice and tight as she lifts and lowers. And you'll notice, you can see the line of her t-shirt is staying nice and vertical. So as the leg lowers, she's not dropping the hip, and as the leg lifts, she's not hiking it either way. She's keeping everything nice and tight. With all of these exercises, we're gonna do around 10 to 15 repetitions, 1 to 2 sets, or as you feel you need. Now we're gonna come into some standing activities. We're gonna start with a single leg squat. So we did 2-legged squats in the first video, single leg squat in the second video. So we're just gonna put one leg forward, she's gonna sit down and stand back up. Some people like to put that opposite leg out in front. You could put it out to the side. We've got a table behind us, you could put it behind you. Whichever direction you choose, it'll challenge the hip that you're standing on a little bit more. We'll do one more here. Same thing with the squats. We want to make sure that this knee, go ahead and stays right in line, tracking over the big toe. All right, next we're going to do is a Bulgarian split squat. Becky's got a nice little trick here for helping with setup. She's going to extend one leg out, and she's going to stand right where her heel lands. The opposite leg comes up onto the table, and we're going to keep this foot here. We're not going to tuck the toes up. The foot's going to stay flat. She's gonna lower down, driving this knee towards the floor. Depending on how tall you are, that knee might not make it all the way down to the floor. If you're just starting this exercise, you might only be able to go halfway. I know you can't see her knee from the front, but she's watching that knee to make sure that it's not turning in or moving out. She's keeping balanced along the whole foot. All right, from here, we're gonna do some box jumps. I recommend, if this is the first time doing this, you start with smaller boxes. You could also do these on your stairs at home if you don't have boxes. You could use a full-size step, like a aerobic step, to do these, but you want to be careful. So she's going to belly muscles in, and she's going to explode up, landing on the box, and then lowering back down. Her goal is to come off of 2 feet and land on 2 feet. From here, we're gonna do lateral step-ups. I'm gonna grab the step that's on the ground here. You can do these once again off the stairs at home or an aerobic step. Same thing, you're gonna repeated theme through all of these activities. The knee needs to track over the second toe. We don't want the knee tracking inside. We don't want it wobbling outside. Becky's doing a nice job of keeping her hips level as she lowers that other side heel to the ground. She's doing the relatively harder version of this. You could put weights in your hands to make it even more challenging. But if you're a beginner, you could point your downside toe. So maybe you're only just dipping that toe into water. That's what it should feel like. Now she's gonna go forward. So once again, same with those single leg squats where you can reach the leg forward or to the side to challenge different muscles. Same thing here. She's doing a forward dip and coming back up. There's all kinds of talk about whether or not the knee should travel past the toe. And there are many times in our daily activities that the knee does in fact need to travel past the toe. This is a good way to start challenging that knee in that range of motion, especially if you're looking at doing deeper squats where your hips will travel below 90 degrees. Last one we're gonna do. So we're gonna put this around her thighs. We're gonna do lateral steps. As you notice, a lot of these activities revolve around strengthening the hips because that's what really supports the knee. That and the foot and the ankle. So you can make it a little bit easier, the band can come up around the knees. If you need more of a challenge, we can put it around the ankles. Yep, and you take big steps. She's keeping tension on the band the entire time. Knees are facing straight ahead, and she's got her nice trunk support up top. All right, we've got one more exercise. It's called the single leg deadlift. Now, if you have issues with your spine or with your back, as with all these exercises, if you get any increased pain, make sure you're seeking out some guidance to make sure your form is where it needs to be. So she's gonna stand on one foot. Sometimes this is easier to actually do with a weight in your hand. And she's gonna put her back foot as a kickstand. And so from here, she's gonna bend at the hip and come straight forward and come on back up. Now you can see she likes to bend her knee. We're actually gonna keep her knee stable. Good. And then come on back up. Keep her weight forward and come on back up. If you need more challenge, you can lift this leg. She's keeping her back totally straight as she moves through this motion. And you can see that the foot is being challenged with balance, but the knee is staying stable right in front. This will also notice that you might get a stretch in your hamstring as you perform this activity. And that might be your stopping point. Sometimes we're at the gym or we're at a location or we're outside where we don't want to lay down. Maybe we don't have a strap or we don't have the tools and we need some other options for stretching. So this is a great way that you can do this outside. You can do it at the gym. And we're going to show you some standing stretches for the entire hip and that also support the knee. So we're going to start around the side here and we're going to do a hamstring stretch. So she's going to put one foot up. As you noticed, her foot is relaxed. We do that to protect the sciatic nerve. The sciatic nerve runs from the back all the way down to the foot. We don't want to be compromising any other structures just because we're trying to stretch our hamstrings. What she's going to do to get the hamstring stretch is she's going to extend her knee and flex or hinge through her hips. You can see her back is straight. Oftentimes you will have people flexing all the way over. Now you're just stretching your back and that's not what I'm looking for. I'm looking to isolate that stretch to the hamstring, that she can feel it behind her knee all the way to the back of her buttock muscle. Now she's going to stand up. We're going to do a hip flexor stretch. So leg goes up on the table, belly muscles stay engaged, and she's gonna drive through this front knee. Becky, if you can show us where you feel this stretch around the front of the thigh. The key to this one, to feeling that stretch, is you notice she's really kept her core engaged. If you allow that to default, you'll see a big arch in the back, and you'll only feel a stretch in the calf. You won't necessarily feel the stretch in the hip flexor. So you might need to back off, re-engage, keep this tense as you drive this knee forward to get that stretch in the front of the hip flexor. From here, you can also turn sideways and get an inner thigh stretch. From this, you can see where the crease is happening at the hip, and this is a nice way to get a stretch through to her inner thigh. Last one, to get your glutes, you probably might need to get on the ground Or if there's an elevated bench in the area, you can use your bed at home. We're gonna put one leg up. And this is just your standard pigeon pose. From here, it's a nice way to get into the glutes. Sometimes this can be irritating to the knee because of how tight the knee is bent, or she can bring her foot all the way up onto the table, let the knee bend, pull her toes back, and that might make this stretch more comfortable. Go slow with this stretch for sure. Try to incorporate these into your daily routine. Maybe you're doing them in the morning or in the afternoon. You might not be able to use the same range of motion that Becky does. You might only be able to go halfway up, or you might find it more comfortable to start at the bottom of a movement and move halfway towards full standing. Either way, you want to stay in a pain-free range of motion. If you're lucky enough to live in Southeast Michigan, we have 10 Neil King Physical Therapy locations. Click below. You can schedule a free wellness exam, and we can tailor a personalized program just for you to help alleviate your knee pain and get you back into your activities. I'm Dr. Tina Schaffner, and on behalf of myself and Dr. Becky Pace, we thank you for watching this video. Stay tuned for more tips. Click below and subscribe, and you can find out some more ways to keep your body healthy and moving pain-free.